Hi, welcome back to Everyday Behavior. My name is Mary Ann Shepard, and this is the second video in our series this month on goal setting and objectives for individuals with severe and profound intellectual disabilities, for individuals with autism or severe communication delays, and also for individuals with social skill deficits or behavioral challenges. So what exactly do you need to think about in a goal? A lot of these are things that you probably already know, but I do hope maybe this will give you some new ideas or some new ways to conceptualize your goals. So please watch the whole training. That way there might be some new things that you can think about to improve your IEPs or to improve your goals. So what exactly is a goal? A goal is a long-term standard or a long-term vision. It's what you hope to accomplish. So what is it that we hope to accomplish for this particular child? And then your objectives are what you're going to need to do to meet those goals. So think about it this way. If I want to run a 5K, okay, that is my goal. I want to run 3 miles, 3.2 miles. But in order to run 3.2 miles, I can't just walk out of my house and run, right? I'm not that young anymore, and so my body I would have all kinds of injuries. It would be very punishing, very negative. I wouldn't meet that goal, and I would walk away saying, I hate running, right? I can't run. But instead of doing that, what I'm going to do is I'm going to set some very specific goals and objectives. So if you've ever done a walk to 5K, typically you run a minute, walk a minute, run a minute, walk a minute, and then you run 2 minutes, walk 1 minute, run 2 minutes, walk 1 minute, run 3 minutes, walk 1 minute, so on and so forth, until you get up to that continuous running of 30 minutes. Now this builds over time, but your objective is to run 1 minute, walk 1 minute for 30 minutes, okay? So run, walk, up to 30 minutes. And then your next goal and objective is to run 2 minutes, walk 1 minute for 30 minutes. So you can see that it's measurable and it's objective, okay? We're talking about quantities here. How long are we running? How many minutes are we running? How many minutes are we walking? And what's our total time, right? And so those are objectives that we need to meet along the way. So for a child, what are our objectives? If you're looking at eye contact, so say maybe you're working with a child with severe and profound intellectual disability or with level 3 autism and they're not engaging in eye contact. What is it that you want them to do? Okay, well, the first thing that they need to do is they need to orient or look to a person when their name is called. Not necessarily look at their eyes, but they need to orient to that person. So our goal is the child will maintain eye contact for 30 seconds while an adult is speaking, okay, or during a conversation. So that is our goal, 30 seconds of eye contact, right? But in order to get to that goal, the first thing that we need to do is teach them to orient or look when their name is called. And then once they look when their name is called or pause and orient, then we want to start working on pausing and orienting or looking at the eyes, okay? So looking up at the face. Once they pause and orient and look up to the face, then we want to look at how long can we work on that. So if you aren't familiar with shaping and chaining, I encourage you to go back and watch the videos on shaping and chaining in our skill instructional series from about 3 or 4 months ago, where we were talking about teaching new skills. And so you can see more videos on that and how to engage in shaping and chaining with a child. But when we're looking at our goals, our goal is eye contact. And a parent will often say, I want my child to look at me when I call their name or look at me when I'm talking to them. And then we have to look at what are all the baby steps that we need to take to get there. So those are our objectives. So what should goals be? Your goals should pass the yes/no test. Yes, they can do them, or no, they can't. They also need to pass the stranger test. What is the stranger test? That means that somebody opens up this IEP or looks at this IEP, they know what you're talking about. So I can say, yes, the child is giving me eye contact, or no, the child is not giving me eye contact. Whether I'm familiar with this child, this IEP, or this goal and objective in particular. Anybody could do it. And it needs to be directed towards the student needs. So eye contact is a very important cusp or keystone behavior that opens up so many other communication skills. So it's important to address that basic need prior to moving on to other more advanced social skills. We want to make our goals measurable. So how can you make goals measurable? You can look at percent. So maybe the percent of opportunities that they respond, so 80% of the time. But when you're looking at 80%, when you say 80% of the time, you're not measuring all the time. So you may say 80% of the opportunities observed. So that means when you're collecting data, it may be 8 out of 10 opportunities. So you provide 10 times or 10 kind of presses or trials. And if they respond, 80% of those trials that you're trying. So you can look at that percent. And that gets into your accuracy as well. So if it's a yes, no thing, did they get it right? Did they get it wrong? What's their percent of accuracy? So if you're thinking about accuracy in mathematics, what's the percent of times that they count accurately, or that they get a math problem accurate? But you can also apply this to how many times do they accurately count to 10. So they will count to 10 with 100% accuracy, right? You can look at frequency. We'll do it 2 consecutive times or 3 consecutive times. So that means you give the opportunities and then do they do it those consecutive times. So on 3 consecutive days, the child will look at the staff member for 30 seconds during small group instruction. Okay. Or you can look at duration. And so 30 seconds of time, that is a duration. How much time will they do that? So the student will sit in their seat for 5 minutes, or sit at the table for 5 minutes on 2 consecutive opportunities. So going back to our last video, sitting at the table and engaging in a leisure activity for 5 minutes, that's a duration of time. So those are all ways. I think sometimes in the education field, we get stuck in that percent, like it has to be a percent, 80% of the opportunities or 80% of the time. But don't be afraid to look at that duration or the frequency that you're looking at things. Have timelines for those goals and objectives. When you set down the timeline, it really pushes you to move towards that goal. But don't make your timelines too ambiguous or too broad. And so really look at what are our timelines for this goal and how can we break those objectives into smaller timelines so that we're continually addressing these. Because for me, I have to have timelines. I'm working on some big projects, and so I set goals and timelines for myself to get to these larger projects. So if I have a really big project that I'm working on, I have my timelines. Even for these videos, I have my timelines of when I need to have the videos created, when I need to have them uploaded, when I need to have them edited. All of those things have timelines in them. So we need to have small timelines for our kids. And if we're just looking at 9-week or quarterly timelines, sometimes those are too broad and we lose sight of the goal until we sit down to look at our quarterly report. And so how many sessions do you want them to complete this goal in, or the number of days or weeks to complete it? You need to delegate too. So especially if you are the teacher of record for the IEP, it's really hard for you to address individual student needs for a bunch of students. And so who is going to be responsible for helping with these goals? Eye contact is something that's so easy to address. Tabletop leisure activities, that's something that a regular classroom teacher can also work on. Other people can work on responding to name. The paraprofessional, maybe if they have a para or an aide that works with them or works in the classroom like a classroom aide, they can also be responsible for working on these goals throughout the day. And so who can help with this? Where will it be taught or learned? And how can you pull in other resources to make these things available? Thank you for watching this video. I hope that it's provided some valuable insight to you. Please follow us on YouTube so you'll know other videos and when our next series comes out. And please visit our Facebook page and you can see accompanying infographics or flyers that go along with these so that you have something in hand to take with you. Thank you for watching and have a wonderful day.